Okay, hello everyone. I know that most of you are working this evening and couldn't be here for this, so I'm just going to go ahead and record it for you so that you can get the rest of this content for Intro to Clinical Nursing. So this first thing that I'm going to talk about is Chapter 6. So Chapter 6 is called Health and Wellness. So let me see if I can share my screen so you can see what the heck I'm talking about. All right, so the big things out of this chapter. So the first part of the chapter, it defines what health is. So it says that health is the state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So the rest of this starts getting into a little bit about Healthy People 2020. So Healthy People, it's a Surgeon General's report on health promotion and disease prevention. So it comes out every so many years. And so originally they did one in 2000 and they kept going from there. So anyway, this serves as a roadmap for improving the health of all people in the United States. So it looks at different areas where, we need improvement, and it kind of, goes from there. So Healthy People 2020 goals are on the next slide. So this is what those are. So attain high quality, longer lives free of preventable disease, disability, injury, and premature death, to achieve health equity, eliminate disparities, and improve the health of all groups, create social and physical environments that promote good health for all, and promote quality of life, healthy development, and healthy behaviors across all life stages. So again, back to that definition of health. So it's the state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So this, came about from the World Health Organization back in 1947. So it's a state of being that people define in relation to their own values, personality, and lifestyle. So it's up to us to help patients identify and reach their health goals. We need to discover and use information about their concepts of health. We need to consider the total person and the environment which the person lives to individualize their nursing care and enhance meaningfulness of their future health status. Excuse me. So then this starts getting into a little bit about models of health and illness. So a model is just this theoretical way of understanding a concept or idea. So there are health belief models and then health behavior models. So health beliefs are a person's ideas, convictions, and attitudes about health and illness. They may be based on factual information or sometimes misinformation, common sense of or myths, or reality or even false expectations. Because health beliefs usually influence health behavior, they can positively or negatively affect a patient's level of health. Positive health behaviors are activities related to maintaining, attaining, or regaining good health and preventing illness. Negative health behaviors include practices actually or potentially harmful to the health. So you can imagine, negative health behaviors would be like eating bad, not getting enough exercise, smoking, those types of things. So when we talk about the health belief model, which we kind of mentioned this in our gerontology class before, this addresses the relationship between a person's beliefs and their behaviors. The health belief model helps you understand factors influencing the patient's perception, their beliefs, and behaviors to plan care that will most effectively help them maintain or restore health and prevent illness. This model has three components: an individual perception of the susceptibility to an illness, an individual's perception of the seriousness of it, and the likelihood that a person will take preventative action. A patient's perception of susceptibility to disease and the patient's perception of the seriousness of an illness helps to determine the likelihood that they will partake in healthy behaviors. So, in other words, if they don't think that the disease is going to affect them at all. Like maybe we could be talking about HIV. If they don't think that it affects them in any way, then maybe they won't take, the proper precautions and do healthy behaviors regarding that. So they need to, have all of the facts so that they can do the right thing there. Then there's a health promotion model as well. So the health promotion model defines health as a positive dynamic state, not merely the absence of disease. So this model focuses on the following three areas: the individual characteristics and experiences, the behavior-specific knowledge and effect, and the behavioral outcomes in which the patient commits to or changes their behavior. Health promoting behavior is the desired behavioral outcome and the endpoint in the health promotion model. Health promoting behaviors result in improved health, enhanced functional ability, and better quality of life. So the models of health and illness, we talk about Maslow's hierarchy of needs a lot. So this is used to understand the interrelationships of basic human needs. According to this model, certain human needs are more basic than others. So as a result, certain needs must be met before others, such as fulfilling the physiologic needs before the needs of love and belonging. The hierarchy of needs model provides a basis for nurses to care for patients of all ages in all health settings. However, when applying the model, the focus of care is on the patient's needs rather than on strict adherency to the hierarchy. To provide the most effective care, you need to understand the relationships of different needs and the factors that determine the priorities for each patient. Healthcare has begun to take a more holistic view of health by considering emotional and spiritual well-being and other dimensions of individual to be important aspects of physical wellness. In this model, nurses using the nursing process consider patients to be the ultimate experts concerning their own health and respect patient's subjective experience as relevant in maintaining health or assisting in healing. In the holistic health model, patients are involved in the healing process, thereby assuming some responsibility for their health maintenance. Nurses use holistic therapies either alone or in conjunction with conventional medicine. So there are variables that influence health and health beliefs and practices. So these variables would influence how a person thinks and acts. Health beliefs can negatively or positively influence health behaviors or health practices. So for instance, if I live in a neighborhood that isn't really good and I have a lot of pollution around me and stuff, that's going to influence how I perceive my own health and what I do. Like your circumstances are going to affect that. Okay, so then there are internal variables that include a person's developmental stage, their intellectual background, perception of functioning, and emotional and spiritual factors. The nurse considers the patient's level of growth and development when using health beliefs and practices as a basis for planning care. A person's thought and behavior patterns change throughout life. A person's beliefs about health are shaped in part by their knowledge, their lack of knowledge, or incorrect information about body functions and illnesses, educational background, traditions, and past experiences. These variables influence how a person thinks about health. In addition, cognitive abilities shape the way a person thinks, including the ability to understand factors involved in illness and apply these experiences. These variables influence how a patient thinks about health. In addition, cognitive abilities shape the way a person thinks. Oh, excuse me, I think I said that already. When you assess a patient's level of health, gather subjective data about the way they perceive physical functioning, such as level of fatigue, shortness of breath, or pain. then obtain objective data about factual functioning like blood pressure, height measurement, lung sounds. This information allows you to move successfully and plan and implement and individualize their care. So the manner in which a person handles stress throughout each phase of life influences the way he or she reacts to illness. A person who generally is very calm may have little emotion response during illness, whereas another individual may be unable to cope emotionally with the threat of illness and may overreact or deny the presence of symptoms or not take therapeutic action. Spirituality is reflected in how a person lives his or her life, including the values and beliefs exercised, the relationships established with family and friends, and the ability to find hope and meaning in life. Religious practices are one way that people exercise spirituality. Some religions restrict the use of certain forms of medical treatment. Then there's also external variables to consider. So some of these include family practices, socioeconomic factors, and cultural background. The way that patients' families use healthcare services generally affects their health practices. Their perceptions of the seriousness of diseases and their history of preventative care behaviors or lack of them influence how patients think about health. Social and psychosocial factors increase the risk for illness and influence the way that a person defines and reacts to illness. Psychosocial variables include the stability of the person's marital or intimate relationship, lifestyle habits, and occupational environment. Social variables partly determine how the healthcare system provides medical care. The organization of the healthcare system determines how patients obtain care, the treatment method, economic cost to the patient, and potential reimbursement to the healthcare agency or patient. Like social variables, economic variables often affect a patient's level of health by increasing the risk of disease and influencing how or at what point the patient enters the healthcare system. Cultural background influences beliefs, values, and customs. It influences the approach of the healthcare system, personal health practices, and the nurse-patient relationship. Cultural background also influences an individual's beliefs about causes of illness and remedies or practices to restore health. Okay, so then we get into health promotion, wellness, and illness prevention. So nursing incorporates health promotion activities, wellness education, and illness prevention activities rather than simply treating illness. So health promotion activities help maintain or enhance health. Wellness education teaches patients how to care for themselves. Illness prevention activities protect against health threats and thus maintain an optimum level of health. These activities can be passive or active. Individuals learn passive strategies from others without their own participation. Active strategies motivate the individual to adopt health programs. The goal of the Total Health Program is to improve a patient's level of well-being in all dimensions, not just physical health. Total health programs are based on the belief that many factors can affect a person's level of health. Healthcare professionals who work in the field of health promotion use proactive attempts to prevent illness or disease. Health promotion activities are passive or active. With passive strategies of health promotion, individuals gain from the activities of others without acting themselves. So the fluoridation of municipal drinking water and the fortification of homogenized milk with vitamin D are examples of passive health promotion strategies. With active strategies of health promotion, individuals adopt specific health programs. So this is kind of an important slide, so I would pay attention to this. So levels of preventative care. So there's primary, secondary, and tertiary. So primary prevention is true prevention that lowers the chances that a disease will develop. So this would be things like health education programs, immunizations, nutrition programs, and physical fitness activities. Secondary prevention focuses on those who have health problems or illnesses and are at risk for developing complications or worsening conditions. So secondary prevention is delivered in homes, hospitals, or skilled nursing facilities. So like, if you already have congestive heart failure, you're always at risk for, maybe getting an exacerbation or, something like that. So that's what this is talking about with secondary prevention. So those people, you would focus your teaching and stuff about that. Tertiary prevention occurs when a defect or disability is permanent or irreversible. So with this, it involves it helps patients achieve as high a level of functioning as possible. So this level of care is called preventative care because it involves preventing further disability or reducing functioning. So I always kind of think of tertiary prevention kind of like rehab in a way. So like if I broke my hip and I have to go to rehab for so many weeks, so it helps me to get back to normal so I don't have like a more permanent functional disability. So a risk factor is any situation, habit, or other variable such as social, environmental, physiological, psychological, developmental, intellectual, or spiritual that increases the vulnerability of an individual or group to an illness or accident. Genetic and physiologic factors such as being overweight affect physical functioning of the body. Heredity or genetic predisposition to specific illness is a major physical risk factor. Age affects a person's susceptibility to certain illnesses. The physical environment in which a person works or lives can increase the likelihood that a certain illness will occur. Environmental things like cleanliness, heat, cold, overcrowding, and air quality would be things that we'd be talking about here. Lifestyle practices and behaviors have positive or negative effects on health. Okay, so there are risk factor modification and changing health behaviors. We kind of talked about this in our gerontology class. When we talked about if someone was trying to maybe like say they're trying to stop smoking or something, they have these different stages they go to or through with trying to change their health behavior. So you have that pre-contemplation stage, then it goes to contemplation and preparation, action and maintenance. So in the pre-contemplation stage, this is where you range from no intention to change, and then you're starting to consider a change within the next 6 months, and that would be contemplation when you're considering it. And then with preparation, you're making small changes. And then if you're actively engaging in strategies to change the behavior, that's the action. And then to maintain a changed behavior, that's your maintenance stage. Okay, so as far as patient teaching goes about lifestyle changes, we want to reduce health risks related to poor lifestyle habits. So we want to provide active listening, ask about perceived barriers, assist the patient in establishing goals, and reinforce the process of the change. And then when we're evaluating this, we want to have the patient track adherence and provide positive reinforcement to them. And it always is helpful when family members support the lifestyle change. That's always goes a long way. So illness is a state in which a person's physical, emotional, intellectual, social development, or spiritual functioning is diminished or impaired. So the difference between acute and chronic is that acute is just a short duration of an illness and chronic is lasting for longer than 6 months. So many chronic illnesses are related to 4 modifiable health behaviors: physical inactivity, poor nutrition, use of tobacco, and excessive alcohol consumption. Patients with chronic diseases and their families continually adjust and adapt to their illnesses. How an individual perceives an illness influences the type of coping response. In response to a chronic illness, an individual develops an illness career. The illness career is flexible and changes in response to changes in health. interactions with health professionals, psychological changes related to grief, and stress related to the illness. So, illness behavior involves how people monitor their bodies and define and interpret their symptoms. Variables influencing illness and illness behavior would be internal and external. Internal is a perception of illness and nature of illness. And then external are visibility of symptoms, social group, cultural background, economics, and accessibility to healthcare. So illness does have a big impact on the patient and family. It's never an isolated event. The patient and family deal with changes resulting from illness and treatment. Each patient responds uniquely to illness, requiring you to individualize nursing interventions. The patient and family commonly experience behavioral and emotional changes as they're going through their illness. All right, so that was chapter 6. So let's see if we can go to chapter 7. Okay, so chapter 7 deals with caring and nursing practice. So caring is central to our nursing practice. The increasing use of technological advances for rapid diagnosis and treatment often causes nurses and other healthcare providers to perceive the patient relationship as less important. However, it's important to preserve the relationship-centered approach to patient caring for all aspects of nursing. The American Organization of Nurse Executives describes caring and knowledge as the core of nursing, with caring being a key component of what a nurse brings to the patient experience. As we go through this chapter, look for ways that these principles align with other perspectives and philosophies of nursing care. So, caring is a universal phenomenon influencing the ways in which people think, feel, and behave in relationship to one another. Since Florence Nightingale, nurses have studied caring from a variety of philosophical and ethical perspectives. A number of nursing scholars have developed theories on caring because of its importance to nursing practice. After listening to staff nurses' stories and analyzing their meaning, Patricia Benner described the essence of excellent nursing practice as caring. Caring means that people, events, projects, and things matter to people. Caring is always specific and relational for each nurse-patient encounter. This is especially important because all patients are different and each patient has his or her own background, values, and cultural perspectives. Developing a caring relationship with your patients and listening to their stories to fully understand their meaning and impact of their condition is important. This information and understanding helps you provide individualized patient-centered care. There was another person called Madeline Leninger who studied caring from a transcultural perspective. So Leninger stresses the importance of nurses understanding cultural caring behaviors. Even though human caring is a universal phenomenon, the expression, processes, and patterns of caring vary among people of different cultures. For caring to be effective, nurses need to learn culturally specific behaviors and words that reflect human caring in different cultures to identify and meet the needs of their patients. So then this gets into Watson. According to Watson, caring becomes almost spiritual. A nurse communicates caring and healing to a patient through their consciousness. This takes place during a single caring moment because nurse and patient have a connection that forms. The model is transformative because the relationship influences both the nurse and the patient for better or for worse. caring and healing consciousness promotes healing. The theory provides direction for how to develop useful and effective caring strategies appropriate for multiple age group and healthcare settings. Swanson's theory of caring includes 5 caring processes: knowing, being with, doing for, enabling, and maintaining belief. Nursing caring theories have common themes. So they identify commonalities as human interaction or communication, mutuality, appreciation of uniqueness of individuals, and improving the welfare of patients and their families. The nurse and the patient enter into a relationship that is much more than one person simply doing tasks for another. There is a mutual give and take that develops as nurse and patient begin to know and care for one another. When a nurse and patient enter a relationship of respect, concern, and support, caring can seem invisible. The nurse's empathy and compassion become a natural part of every patient encounter. However, when caring is absent, it becomes very obvious. Patients can tell when nurses fail to relate to them. As you practice caring, your patient will sense your commitment and willingness to enter into a relationship that allows you to understand their experience or illness. One aspect of caring is enabling, when a nurse and patient work together to identify alternatives and approaches to care and resources. Another common theme of caring is to understand the context of a person's life and illness. It is difficult to show caring for another individual without gaining an understanding of who the person is and his or her perceptions of the illness. This approach is more successful than simply selecting the interventions on the basis of your patient's symptoms or disease processes. Patients value the affective dimension of nursing care. Connecting with patients and their families, being present, respecting their values, beliefs, and healthcare choices. This is all an important part of caring. When we care for others, we preserve their dignity. The term ethic refers to the ideals of right and wrong behavior. An ethic of care is concerned with relationships between people and with the nurse's character and attitude towards others. Nurses who function from an ethic of care are sensitive to unequal relationships that lead to an abuse of one person's power over another, unintentional or otherwise. An ethic of care places the nurse as the patient's advocate, solving ethical dilemmas by attending to relationships and giving priority to each patient's unique personhood. As you deal with health and illness in your practice, you grow in your ability to care and develop caring behaviors. Caring is one of those human behaviors that we can give and receive. Recognize the importance of self-care. Use caring behaviors to reach out to your colleagues and care for them as well. So we learn from our patients. Our patients tell us that a simple touch, a simple phrase, or a promise to remain at the bedside represents caring and compassion. As nurses, it's important to assess both your caring needs and your caring behaviors. You cannot give fully engaged, compassionate care when you feel depleted or uncared for. Take time to recognize stressors and reach out to colleagues and family and friends for help in coping with these stressors. Whether you're giving or receiving care, the value of caring in your nursing practice benefits your patients, your colleagues, and your healthcare agency. So here's some things that are specific to caring that we need to kind of know. So providing presence is a person-to-person encounter conveying a closeness and a sense of caring. Presence involves being there and being with. Being there is not only a physical presence, it also includes communication and understanding. Nursing presence is the connectedness between the nurse and the patient. The outcomes of nursing presence include alleviating suffering, decreasing a sense of isolation and vulnerability, and personal growth. It is especially important to establish presence and caring when patients are experiencing stressful events or situations. A nurse's presence helps to calm anxiety and fear. So touch is a relational and leads to a connection between nurse and patient. It involves contact and non-contact touch. Contact touch involves obvious skin-to-skin contact, whereas non-contact touch refers to eye contact. Before implementing touch, be aware of your patient's cultural practices and past experiences. For some people, a simple touch on the arm may be perceived as invasive, and for victims of abuse, a simple touch may be perceived as a threat. Nurses use task-oriented touch when performing a task or procedure. Caring touch is expressed in the way you hold a patient's hand or give a back massage, gently position a patient, or participate in a conversation. Protective touch is a form of touch that protects the nurse and the patient. The most obvious form of protective touch is preventing an accident. Because touch conveys many messages, use it with discretion. Know and understand if patients accept touch and how they interpret your intentions. So listening is not only taking in what a patient says, it's also interpreting and understanding what the patient's saying and giving back that understanding. Caring through listening enables you to become a participant in the patient's life. To listen effectively, you need to silence yourself and listen with openness. It is important to remain intentionally silent and concentrate on what the patient has to say. Give patients your full focused attention as they tell their stories. Through active listening, you begin to truly know your patients and what's important to them. Knowing your patient develops over time. The core process of clinical decision-making is part of this. And aspects of knowledge include responses to therapy, routines and habits that your patient might have, coping resources, physical capacities, and endurance. So it's really important to get to know your patient well. And then with spiritual caring, spiritual health is achieved when a patient can find a balance between his values, goals, and belief systems or symptoms and those of others. Spirituality offers a sense of interpersonal, and transpersonal connectedness. An interpersonal relationship is when a person is connected to themselves. Interpersonal relationships exist when one is connected to others and the environment. A transpersonal relationship exists when one is connected with God, an unseen force, or a higher power. So always be aware of your patient's environment, assess symptoms thoroughly, and take the necessary steps to make the environment comfortable. Through skillful and accurate assessment of the patient's level and type of pain or other symptoms, you're able to design patient-centered care to improve the patient's level of comfort. Often conveying a quiet, caring presence, touching a patient, or listening helps you to assess and understand the meaning of the patient's discomfort. The caring presence helps you and your patient design goals for symptom relief. Human suffering is multifaceted. It affects the patient physically, emotionally, socially, and spiritually. It also affects a patient's family and friends. So with family care, so people experience life through relationships with others. Caring does not occur in isolation from the patient's family. Family is an important resource. Success with nursing interventions often depends on the family's willingness to share information about the patient, their willingness and understanding of therapies, whether the interventions fit with their daily practices, and whether they support and deliver the therapies recommended. Learn who makes up the patient's family and their roles in the patient's life. Showing the family that you care for and are concerned about the patient creates an openness that enables a relationship to form with the family. Caring for the family takes the consideration, the context of the patient's illness and the stress it imposes on all members of the family. So there are challenges of caring. So today's healthcare system presents many challenges for the nurse to provide a caring, patient-centered plan of care. Nurses are often torn between the human caring model and the task-oriented biomedical model and institutional demands that consume their practice. Nurses have increasingly less time to spend with their patients, making it much harder to know who their patients are. A reliance on technology and cost-effective healthcare strategies and efforts to standardize and refine work processes all undermine the nature of caring. If healthcare is to make a positive difference in patients' lives, healthcare must become more holistic and humanistic. Nurses play an important role in making caring an integral part of healthcare delivery. This begins by making it part of the philosophy and environment in the workplace. Incorporating caring concepts into standards of nursing practice establishes guidelines for professional conduct. Finally, during day-to-day practice and with patients and families, nurses need to be committed to caring and willing to establish the relationships necessary for personal, competent, compassionate, and meaningful nursing care. All right, so that was chapter 7. So let me see if I can get to the other chapter that we need here. Okay, so this is talking about caring for cancer survivors. So that's our next topic. See if I can get this shared. Here we go. Okay, so unfortunately, a lot of us have to deal with someone that we know that has cancer. Cancer is a life-changing event. With cancer survivorship, there's a lot of people who are cancer survivors in the United States. About 14.5 million people have had cancer. And will continue to grow since more than 1.7 million new cases of cancer are diagnosed each year. It's estimated that by January 2024, there will be 19 million cancer survivors in the United States. So when we talk about cancer survivorship, this begins at the time of cancer diagnosis and includes treatment, extends to the rest of the person's life. Okay. There are many stages of the cancer continuum. The major forms of cancer therapy would be surgery, immunotherapy, chemotherapy, hormone therapy, biologic response modifiers, and radiation therapy. Often create unwanted long-term effects on the tissues and organ systems that impair a person's health and quality of life. Children and adolescents who receive aggressive chemotherapy and radiation are at the greatest risk for developing secondary malignancies, sometimes related to the initial treatment received for the primary cancer. Adult cancer survivors may also experience new malignancies related to prior treatments, but also may be genetically predisposed to recurrent tumors. With continued focus on cancer treatments going beyond acute treatment, healthcare providers are improving care needs for long-term cancer survivors. In this way, cancer survivorship has enormous implications for the way these individuals monitor and manage their health throughout their lives. As a nurse, you will care for these patients when they seek care for their cancer and other medical conditions. As people live longer after diagnosis and treatment for cancer, it becomes important to understand the types of distress that many survivors experience and how it affects their quality of life. Having cancer affects each person's physical, psychological, social, and spiritual well-being. Cancer survivors are at increased risk for cancer and for a wide range of treatment-related problems. A number of tissues and body systems are impaired as a result of cancer and its treatments. Certain conditions resolve over time, but tissue damage causes some symptoms to persist indefinitely, especially when patients receive high-dose chemotherapy. Cancer-related fatigue and associated sleep disturbances are among the most frequent distressing complaints of people with cancer. Chemotherapy-related cognitive impairments are common in people that receive systemic chemotherapy. Often, healthcare providers wrongfully attribute the symptoms of cancer from side effects of treatment to aging. This often leads to late diagnosis or a failure to provide aggressive and effective treatment of symptoms. The physical effects of cancer and its treatment sometimes cause serious psychological distress, including fear of the cancer recurring and also PTSD. PTSD is a psychiatric disorder characterized by an acute emotional response to a traumatic event or situation. The disabling effects of chronic cancer symptoms disrupt family and personal relationships, impair individuals' work performance, and often isolate survivors from normal social activities. Therapies include education, routine exercise, adequate sleep, supportive therapy, or cognitive behavioral interventions, and reassurance that anxiety and depression are commonly seen in cancer survivors. Pharmacological intervention may also be warranted based on individual survivor response. Okay, so with social well-being, impact occurs across the lifespan. For adolescents and young adults, cancer seriously alters their social skills, sexual development, body image, and the ability to think about and plan for the future. Adults aged 30 to 59 who have cancer experience significant changes in their families. Once a member of the family is diagnosed with cancer, every family member's role, plans, and abilities change. Adult patients who experience changes in sexuality and intimacy and fertility see their marriages affected, often resulting in divorce. A history of cancer significantly affects employment opportunities and has affected the ability of survivors to obtain and retain health and life insurance in the past. However, changes in the availability and affordability of health insurance resulting from the Patient Protection and Affordable Care Act has insurance more attainable for cancer survivors. Often a survivor experiences health-related work limitations that require a reduced work schedule or a complete change in employment. Many older cancer survivors require ongoing caregiving support, either from a family member or a professional caregiver. Cancer challenges a person's spiritual well-being as well. Cancer and its treatment create physical and psychological changes that cause survivors to wonder if their disease is a form of punishment. However, cancer survivors who participate in religious activities and report belief in God experience increased emotional functioning and coping. Cancer affects all members of a family. Family caregiving is stressful. You have physical and psychological demands, and family undergoes a lot of distress at times. So usually a member of the family becomes the patient's caregiver. Family caregiving is a stressful experience depending on the relationship between the patient and the caregiver and the nature and extent of the patient's disease. Members of the sandwich generation, which would be caregivers who are 30 to 50 years old, are often caught in the middle of caring for their own immediate family and a parent with cancer. Families struggle to maintain core functions when one of their members is a cancer survivor. Core family functions include maintaining an emotionally and physically safe environment, interpreting and reducing the threat of a stressful event for family members, and nurturing and supporting the development of individual family members. In the end, family functions become fragmented and family members develop an uncertainty about their roles. Nurses are in a great position to lead the charge for better management of long-term consequences of cancer. It's important to assess a cancer survivor's need as a standard part of your practice. A narrative makes it possible to know people through their stories and provides contextual detail and person revealing characteristics that make them individuals. Be aware that some patients do not always report that they have cancer. Thus, when a patient tells you he or she has had surgery, ask if it was cancer related. Consider not only the effects of the cancer in its treatment, such as potential symptoms, but how it will affect any other medical conditions. Symptom management is an ongoing problem for many cancer survivors. If cancer is their primary diagnosis, it will be natural for you to explore any presenting symptoms. Because you know the cancer affects a patient's quality of life in many ways, be sure to explore the patient's psychological, social, and spiritual needs and resources. One area that's often difficult for nurses to assess well is the patient's sexuality. Sexuality is more than simply the physical ability to perform a sex act or conceive a child. It also includes a person's self-concept and body image, sexual response, and sexual roles in relationships. When you care for a cancer patient, it's important to understand whether the patient administers most of his or her own self-care or if support is required from a family caregiver. This is an essential to provide the most appropriate patient education, both in the form of content and in your teaching approach. It's the nurse's responsibility to educate cancer survivors and their families about the effects of cancer and cancer treatment. If you teach patients and their family caregivers about the potential for treatment effects like pain, neuropathy, and cognitive change, they are more likely to report their symptoms. It allows them to know which signs or changes to anticipate and monitor. Because survivors have an increased risk for developing a secondary cancer or chronic illness, it's important to educate them about lifestyle behaviors and the importance of participating in ongoing cancer screening and early detection practices. Many survivors become interested in learning about dietary supplements and nutritional complementary therapies to manage disease symptoms. Teach patients useful strategies to promote their health. Okay, so this gets into this conceptual model done by Schumacher. It's the transactional model of cancer family caregiving skill, which describes the relationship among cancer patients and family caregivers and the performance of family caregiving skills. The model offers a perspective on caregivers and cancer survivors, both as individuals and as a team. Family caregiving skill is the ability to respond effectively and smoothly to the demands of an illness and pattern of care using multiple caregiving practices. Illness demands of cancer include dealing with symptoms, responding to illness behaviors, modifying activities of an illness situation, nutritional support, interpersonal care, use of community resources, managing acute illness episodes, and implementing treatments. The patient and caregiver follow a continuum of 3 patterns of care. The self-caregiving pattern, patients are most independent with caregivers in a standby role. The collaborative care pattern, where patients and caregivers share care activities and respond together to illness demands. And the family caregiving pattern, where patients are unable to perform independently and require extensive caregiver involvement. A patient's and caregiver's response to a caregiving demand involves performing caregiving processes such as monitoring and observing for problems, interpreting, identifying the problem, and making decisions and adjustments, accepting resources and providing hands-on care. Okay, so numerous organizations provide resources for cancer survivors. However, many survivors do not receive timely and appropriate referrals to them. As a nurse, you will find that many people, friends, neighbors, and family members come to you for advice about healthcare before they actually become a patient. It's important to know that cancer-related hospital and ambulatory care are not standardized. Hospital-based oncologists are usually in larger hospitals and not in smaller ones. A National Cancer Institute designated cancer center offers the most comprehensive and up-to-date clinical care. National Cancer Institute designated centers also conduct important clinical trials to investigate the most current cancer therapies. Your role is to tell patients about the different resources available so they are able to make informed choices about their care. Refer patients to the NCI website. It contains a current list of NCI designated comprehensive cancer centers. A wealth of cancer-related community support services is available to survivors through voluntary organizations like the American Cancer Society. Healthcare professionals are not consistent in referring patients to these valuable services. In addition, although community-based services help most survivors, there are gaps in service provisions for assistance with transportation, home care, child care, and financial assistance. Be knowledgeable about the services within your community. So once primary cancer treatment ends, healthcare professionals need to develop an organized plan for survivorship care. This does not always occur because inadequacies in the healthcare system, including a healthcare provider not assuming responsibility for coordinating care, fragmentation of care between specialists and general practitioners, and a lack of guidance about how survivors can improve their health outcomes. To meet the healthcare needs of cancer survivors, it's essential to have a survivorship care plan. So as of 2015, fully accredited cancer centers must develop and disseminate a comprehensive patient-specific follow-up survivor care plan for all patients when they complete treatment. Patients who receive care at a cancer center without this type of resource may not have a survivorship care plan. The IOM also recommends that health insurance plans cover care outlined in the survivorship care plan. Ideally, you review a survivorship care plan with a patient when he or she is formally discharged from a treatment program. The plan then becomes a guide for any future cancer or cancer-related care. Barriers to develop and implement survivorship care plans focus on financial and human resource costs. Cancer organizations such as the Lance Armstrong Foundation, the Association of Cancer Online Resources, provide internet guides for the development of survivorship care plans. Nurses and other healthcare providers need to become more vigilant in recognizing cancer survivors and attempting to link them with the support and resources they require. Nurses make a difference when they consider the long-term issues that cancer survivors face with their time of diagnosis and in contributing to solutions to manage and relieve cancer-associated health problems. Okay, so then we just have one more to go through. Okay, so this is talking about the caring for families. So this is chapter 10. So family continues to be a central institution in American society. So the family structure and function influences the lives of the family's individual members. The concept, structure, and functioning of the family unit continue to change over time. Families face many challenges, including the impact of health and illness, childbearing and child rearing, and changes in family structure and dynamics, as well as the challenges of caring for older parents. Families face many challenges, including the impacts. As you care for patients and their families, you're responsible for understanding family dynamics, which includes how the family's made up, their structure, function, and problem solving and coping capacity. Use this knowledge to build on the patient's and family's strengths and resources. All right, so families represent more than a set of individuals. A family is more than a sum of its individual members, and families are very diverse, especially today. As a nurse, you need to assess for and understand how your patients define their families and how they perceive their general state of member relationships. Think of the family as a set of relationships that the patient identifies as family, or a network of individuals who influence one another's lives, whether or not they're actual biological or legal ties. So, what is a family? So, defining family is not as simple as one might imagine. Think about how the definition of family impacts health insurance policies and who has access to children's school records, who files joint tax returns, and who is eligible for sick leave benefits or public assistance programs. For some patients, family includes only persons related by marriage, birth, or adoption. To others, aunts, uncles, close friends, cohabitating people, and even pets are family. Understand that family takes many forms and have diverse cultural and ethical orientations. Family forms are patterns of people considered by family members to be included in the family. The nuclear family consists of a husband and wife and perhaps one or more children. The extended family includes relatives, aunts, uncles, grandparents, cousins, in addition to the nuclear family. The single parent family is formed when one parent leaves and the nuclear family because of death, divorce, or desertion, and a single person decides to have or adopt a child. The blended family is formed when parents bring unrelated children from a prior relationship into a new, living situation. Alternative family relationships include multi-adult households, skip generation families where grandparents are caring for grandkids, and then there's also communal groups with children and non-families cohabitating together, and there's also homosexual couples. Although all families have some things in common, each family form has unique problems and strengths. Remain open about who makes up a family so you do not overlook potential resources and concerns. So here are some various family trends and family forms in the United States. Although the institution of family remains strong, the family itself is changing. In some situations, people are marrying later, women are delaying childbirth, and couples are choosing to have fewer children or none at all. Between 2006 and 2010, the Centers for Disease Control and Prevention reported the probability of a first marriage lasting at least 10 years as 68% for women and 70% for men, and the probability of a first marriage surviving 20 years as 52% for women and 56% for men. A number of divorced adults remarry, resulting in blended families. Marital roles are also more complex as families increasingly include two wage earners. The number of people living alone is expanding rapidly and represents approximately 25% of all households. 41% of children are living with mothers who have never married. The majority of adolescent mothers continue to live with their families. A teenage pregnancy has long-term consequences for the mother. Approximately half of all gay male couples live together compared to 3/4 of lesbian couples. The fastest growing age group in America is 65 years of age and older. For the first time in history, the average American has more living parents than children, and children are more likely to have living grandparents and even great-grandparents. This graying of America continues to affect the family's life cycle, particularly the sandwich generation, composed of children of older adults. These individuals, who are usually in the middle years, have to meet their own needs along with those of their children and their aging parents. The balance of needs often occurs at the expense of their own well-being and resources. Okay, so for some families, making ends meet is a daily concern because of their declining economic status. As a result, many families have inadequate health insurance coverage. The number of American children living below the poverty level continues to rise. You can be an advocate for these families and work with the case management to find community assistance when needed. Homelessness continues to be a major public health issue. The fastest growing homeless population is families with children. Homeless families and their children are at serious risk for developing long-term health, uh, psychological, and socioeconomic problems. Domestic violence includes not only intimate partner relationships of spousal, live-in partners, and dating relationships, but also familial, elder, and child abuse. Abuse includes emotional, physical, and sexual abuse, which occurs across all social classes, although abuse sometimes ends when one leaves a specific family environment. Negative long-term physical and emotional consequences are often evident. So there are some impacts of illness and injury to the family. So any acute or chronic illness influences the entire family economically, emotionally, socially, and functionally, and also affects the family's decision-making and coping resources. Hospitalization of a family member is stressful for the whole family. When implementing a patient-centered care model, patient, family members, and surrogate decision makers must become active partners in decision-making and care. Incorporating the patient's and family's cultural beliefs, values, and communication patterns is essential to provide individualized patient and family-centered care. Chronic illnesses are a global health problem and present continuous challenges for families. Despite the stressors, families want to accept and manage the illness and strive to gain a balance in family life. Nursing care involves the patient and family in preventing and/or managing medical crisis, controlling symptoms, learning how to provide specific therapies, adjusting to changes over the course of the illness, avoiding isolation, obtaining community resources, and helping the family with conflict resolution. Trauma is sudden, unplanned, and sometimes life-threatening. Family members often struggle to cope with the challenges of severe life-threatening event, and caring for family members, advocate for the patient and family, and answer their questions honestly. When the victim of trauma is hospitalized, take time to make sure that the family is comfortable. You will encounter many families with a terminally ill member. Although some family members may be prepared for their loved one's death, their need for information, support, and assurance and presence is great. Use presence and therapeutic communication to enhance family members' relationships with one another and promote shared decision-making. Help the family set up home care if they desire and obtain hospice and other appropriate resources, including grief support. If you are present at the time of death, be sensitive to the family member's needs. Understanding family developmental stages and attributes enables you to provide nursing care to the patient, the family as a whole, and the individuals within the family structure. These theoretical perspectives and their concepts provide the foundation for family assessment and interventions. Although each family is unique, all families tend to go through common stages. Each developmental stage has its own challenges, needs, and resources, and includes tasks that need to be completed before the family is able to successfully move on to the next stage. McGoldrick and Carter based their 1985 classic model of family life stages on expansion, contraction, and realignment of family relationships that support the entry, exit, and development of its members. Use this model to promote family behaviors to achieve essential tasks and help families prepare for later transitions. Each family is unique to its structures and function. Structure either enhances or detracts from a family's ability to respond to the expected and unexpected stressors of daily life. Structures that are too rigid or flexible can threaten family functioning. Rigid structures specifically dictate who accomplishes different tasks and also limit the number of people outside the immediate family allowed to assume these tasks. An extremely flexible structure also prevents problems for the family. There is sometimes an absence of stability that would otherwise lead to automatic action during a crisis or rapid change. Specific functions include the way a family reproduces, raises the children, cooperates to meet economic needs, and relates to the larger society. Family functioning also focuses on the processes used by the family to achieve its goals. Families achieve goals more successfully when communication is clear and direct. When assessing the family, it's important to use a guide such as a family health system approach to identify all their needs. The family health system is a holistic model that guides the assessment and care for the family. It includes 5 realms or processes of family life: interactive, developmental, coping, integrity, and health. The family health system approach is one method for family assessment to determine areas of concern and strengths, which helps you to develop a plan of care with outcomes and specific family nursing interventions. The health status of each individual influences how the family unit functions and its ability to achieve goals. When the family meets its goals, the members tend to feel positive about themselves and their family. When they do not meet their goals, families view themselves as ineffective. Family is the primary social context in which health promotion and disease prevention take place. Some families do not place a high value on good health. Attributes of healthy families include hardiness and resilience. So family nursing is based on the assumption that all people, regardless of age, are members of some type of family. To provide care, you need to know about families and family theory. A nurse can view the family in 3 ways: as context, as the patient, or as a system. If you're looking as family as context, when you look at the family as context, you will want to remember that the primary focus is on the health and development of individual members who exist within a specific environment. Although the focus is on the individual's health status, assess how much the family provides that individual's basic and psychological needs. If you're looking as family as patient, the family processes and relationships are the primary focuses of nursing care. Focus your nursing assessment on family patterns rather than characteristics of individual members. Concentrate on the patterns and processes that are consistent with reaching and maintaining family and individual health. Family as system. Remember that looking at the family as a system requires that you look at the family as context and as patient. These 2 perspectives are not mutually exclusive. You may use them simultaneously. The nursing process is the same whether the focus is context, patient, or system. Family assessment is a priority to provide adequate family care and support. The form, structure, function, and health of the family are areas unique to family assessment. The 5 areas of family life to include in an assessment are the interactive, development, coping, integrity, and health processes of the family. Always recognize and respect a family's cultural background during your assessment. Knowing about a family's culture and the meaning of the culture to a family's structure and functioning and health practices and family celebrations helps to design family-centered care. If a patient has been hospitalized or is in a rehab setting, discharge planning begins with the initiation of care and includes the family. So you're responsible for including them with that. So a number of diagnoses within the domain of role relationships are identified by NANDA as, stuff that you could use here. So identify actual and at-risk nursing diagnoses. When you're planning care, plan care that members clearly understand and agree to follow. Set goals and outcomes that are realistic, compatible with a family's developmental stage, and acceptable to family members and their lifestyle. Collaborate with other disciplines and support communication among family members. The routine provision of services and personal care activities for a family member by spouses, siblings, friends, or parents. Activities include finding resources, providing personal care, monitoring for complications or side effects, providing instrumental activities of daily living, and ongoing emotional support and decision making. Those might be some things you'd be focused on. When implementing family health promotion interventions are designed to improve or maintain the physical, social, emotional, and spiritual well-being of the family unit and its members. Health promotion behaviors need to be tied to the developmental stages of the family. Your intervention should be designated to enable individual members and the total family to reach their optimal levels of wellness. One approach for meeting goals and promoting health is the use of family strengths. Families do not often look at their own system as one of inherent positive components. Family strengths include clear communication, adaptability, healthy child rearing practices, support and nurturing among family members, and use of crisis for growth, a commitment to one another and the family unit, and a sense of well being and cohesiveness and spirituality. The family must be the central focus of nursing care, and it's crucial to emphasize the family needs within the context of today's acute healthcare delivery system. Do not assume that there are multiple people in the family, that family caregiving is easier to attain. Often, when family members assume the role of caregiver, they lose support from a significant other and are at risk for caregiver role strain. Always be sure that families are willing to assume care responsibilities once a patient returns home. Knowledge about the family's patient and family's needs is essential to drive nursing interventions and maximize nursing outcomes. Identify who makes decisions for the family and consistently go to the decision maker. In an acute care setting, clear communication is essential. Clear communication from healthcare team helps to untangle medical terminology and enables the family to understand the healthcare issues, types of decisions, and healthcare outcomes. In restorative and continuing care settings, the challenge in family nursing is to try and maintain patients' functional abilities within the context of the family. This includes having home care nurses help patients remain in their homes following acute injuries or illnesses, surgery, or exacerbations of a chronic illness. It also requires finding ways to better the lives of the chronically ill and disabled individuals and their families. Okay, guys, so that is the end of that. So that's the end of all of our PowerPoints for this term. So the rest of everything that we have gone over will be on your final.